Welcome to the Northwestern Health Unit's naloxone training. During this training, you will learn what naloxone is and what it's for, as well as some useful background information on what an opioid is, how to spot an overdose, how to administer naloxone, and the laws surrounding administration. What is an opioid? An opioid is a class of drugs naturally found in the poppy plant or made synthetically. Opioids can be prescribed by a healthcare provider, or they can come in the form of illicit substances such as heroin or powdered fentanyl. They produce a variety of effects such as relief of moderate to severe pain or euphoria. They can cause additional side effects such as slowed breathing, nausea, or drowsiness. And some examples are codeine, morphine, hydromorphone, methadone, fentanyl, and heroin. To understand why it's important to know how to administer naloxone, let's look at some statistics. During the first year of the pandemic, there was a 95% increase in apparent opioid toxicity deaths from April 2020 to March 2021, compared to the year before. In Ontario, there were 2,819 confirmed and probable opioid deaths in 2021, which is 15% higher than 2020. A total of 5,368 apparent opioid toxicity deaths occurred in 2021 from January to September. This is approximately 20 deaths per day. And deaths from drug-related overdoses is a leading cause of accidental deaths in Ontario. How to recognize an overdose. Signs and symptoms of an opioid overdose may include breathing that is slow or stopped, lips and nails that are blue, the person is unconscious, they are unresponsive to stimuli, they produce gurgling sounds or snoring, their skin feels cold and clammy, and their pupils are very small. These symptoms can also be seen in other medical conditions, especially if the overdose is not witnessed and a person is found unconscious. As you will learn in this presentation, naloxone can be administered to someone who is not experiencing an opioid overdose without causing any negative health outcomes. What is naloxone? Also known as Narcan, naloxone is a medication that can temporarily reverse the effects of an opioid overdose and allow time for medical help to arrive. Only effective with opioids, it will not reverse overdose for other drugs, but it will not cause harm if given when the drug is unknown. It's called an opioid antagonist, meaning it blocks the brain receptors and thus the effects of opioids. It can restore respiration to someone who has stopped breathing due to an overdose, and it can prevent death or brain damage due to lack of oxygen during an overdose. Inside your naloxone kit, you will find 2 doses of naloxone, 4 milligrams or 0.1 cc each, a client identifier card, 5 steps to save a life, a mouthpiece or mouth cover for artificial respiration, and a pair of gloves. Please note that the naloxone kit must be stored at room temperature, and you must always check the expiry date. Risks with receiving naloxone. Most risks are related to the sudden withdrawal symptoms that naloxone causes in someone who is dependent on opioids, such as pain, vomiting, weakness, sweating, irritability, seizures, or abdominal cramps. But just remember, naloxone is safe to give even if you are unsure. How to use intranasal naloxone. It is important to follow your organization's policies and procedures related to emergencies, but here are the general steps when there is an emergency where an opioid overdose is suspected. 1. Call 911. 2. Peel back the package to remove the device. 3. Place the person on their back. Place your thumb on the bottom of the plunger with 2 fingers on the nozzle. Place the tip of the nozzle in the nostril until your fingers touch the bottom of the person's nose. 4. Press the plunger firmly to release the dose into the patient's nose. 5. begin chest compressions and/or rescue breathing as you are able. 6. Repeat dose if no response in 2 minutes, or if the person becomes unconscious again, be sure to alternate nostrils. How long does it last? Naloxone stays active in the body for about 45 to 90 minutes. However, the opioid may last longer, so the person can re-overdose. This is why it's so important to first call 911 so that the person can be monitored by medical professionals post-overdose. If the person does not start breathing on their own within 2 to 3 minutes, or the person becomes unconscious again, administer a second dose, making sure to alternate nostrils. Care after administering naloxone. How will you know if it's working? Well, when the naloxone starts working, the individual may wake up suddenly or slowly, be disoriented, or may experience some of the adverse effects noted previously. If possible and safe, stay with the person until emergency services arrive in case paramedics need more information or the overdose symptoms return. Continued care after administering naloxone. First and foremost, follow your organization's emergency response policy and protocols. Then, follow up and debrief. This is an important part of quality improvement, support, and self-care for the rescuer and the victim, as well as for leadership. Debriefing is so important because it gives everyone involved a chance to share their feelings, to get support from colleagues and leadership, and it's a chance to review what went well and where improvements can be made. Debriefing with the rescuer and victim should happen shortly after the incident and in the days following as required. Lastly, always ask about getting a replacement Naloxone kit. The Good Samaritan Act. This act provides legal protection to people who give reasonable assistance to those needing help in a life-saving situation. Its purpose is to keep people from being reluctant to help in an emergency for fear of legal repercussions should they make some mistake in treatment. There is no risk in helping anyone overcome an overdose by giving naloxone. Citizens are protected by the Good Samaritan Act, which, in subsection 2, states that people included in the Act are healthcare professionals who provide emergency services outside of a healthcare facility, and it also includes individuals who are not healthcare professionals who provide emergency assistance to a person who is ill, injured, or unconscious as a result of an accident or other emergency, if the individual provides the assistance at the accident or the emergency. If you ever need a new Naloxone kit, either because yours has expired or it was used, you can find a replacement at your local Northwestern Health Unit office for free. Other locations like pharmacies may offer replacement kits, but they may not be free. If you are curious as to where you can find a Naloxone kit, visit Ontario's Where to Get a Naloxone Kit page on their website. You've made it to the end. Thank you so much for participating in our opioid overdose prevention and naloxone training.